Oh yeah, it's time for a little reviewage. Alright, it is 1:45 in the morning. We've got a lot to cover, but a little bit of time to do it in, because I'm fucking tired. So we're going to hop around. We got a whole bunch of stuff to go over. We got chapters 21, 22, 23, some of 24, and some of 29 in maternity. And that would be this book right here, Introduction to Maternity and Ped Nursing. And as I go over stuff, I'm going to give you page numbers to reference so you can follow along if you really want to, or you can just write it down. So we're going to start out with Lost IDs. I don't have a page number on that one because I forgot to write the page number down. So anyway, bottom line for a lost ID, if you have a kid who has lost their ID bracelet, the two big things that you're going to want to do, first off, you're going to want to verify that kid's identity immediately. Primarily, you're going to identify that with the parent, because nobody knows their kid more than the parent does. So you're going to verify their identity, and you're going to get a new bracelet issued to them. And when you get that bracelet issued to them, you want to make sure that it's snug, but not cutting off circulation. We don't want to lose the bracelet again. Okay, so we're going to move on to a clean catch urine specimen. Basically, a clean catch, it's when you catch a urine specimen midstream. The important things you want to remember is you want to cleanse the perineum with an antiseptic. You want to rinse and dry it. And you want to make sure that when you wipe the perineum, you wipe from front to back before you do this. And then you have the child start to urinate, and you place the container in midstream. And that's going to be your clean catch for urine. So let's move on to oral medications and how we would give those to kids. And that's going to be on page 516. Flip, flip, flip. As soon as I can get there. So many hopping around. Okay, basically for an infant, you want to apply the bib. You want to support and elevate the head and shoulders. Now, the thing you want to avoid when giving oral medications is you don't use teaspoons, you don't use tablespoons, you don't use spoons. You want to focus on using disposable syringes. Those are set with measurements right on the side of the syringe, so you know you're getting the accurate amount. You want to depress the chin with the thumb to the mouth, slowly insert the medication along the side of the mouth. It's the same principle as suctioning. You want to do it to the side of the mouth so that you don't hit the gag reflex. And that's pretty much it for oral medications. So, moving along, eardrops for, say, a 4-year-old. Let me see, I gotta find that page. And I got all kinds of stuff written down everywhere, it's crazy. Let me see. Wait for it. Where the hell did I write it? No, I can't find it. 531 we're going to go to in the book. Wait for it. Too much page flipping. It's crazy. It's insane. Can't keep up with this shit. Okay, basically when you're giving eardrops to a 4-year-old or an infant, you're going to pull the pinna of the ear down and back in children. This is opposite of what you would do with an adult. With an adult, you would actually pull the top of the ear up and back. And the reason for this is because the eustachian tube in an infant and smaller toddlers is shorter, it's straighter, and it's wider. So, down and back for eardrops for 4-year-olds. Very important to remember. Now, we go into therapeutic responses for needle fear. Basically, what you want to do when you have a toddler or a young child who is afraid of needles, you can do a couple of therapeutic things. Obviously, you're going to comfort the child. You're going to talk to the child. You're going to maybe ask him a little bit about what's so scary about it. You're going to want to explain to him. Again, parents, as I said before for chapter 21, I think I did, involve the parents, right? So you're going to have the parents there, and you're also going to do, if it's possible, you want to try to give the child a choice in where the injection would actually go. Sometimes that helps them because they feel they have a little bit more control, and that'll help them out a little bit. So we're going to move on to we're going to move backwards to page 505. continuing on with IM injections. You've got basically your two sites that you're going to use for IM injections for small kids is your vastus lateralis, which that's the muscle along the thigh, and you're going to use that in infants that don't walk yet, because you're not going to be really worried about them walking on it and irritating it and all that other stuff. Now, when you have a child who's been walking for a year or more, that's when you go into the ventrogluteal site, and that is basically on the side of the upper thigh, right by the pelvis. So that's on page 505 if you want to check that out. Now, we're going to go back again to page 500, and we're going to talk a little bit about lumbar punctures for kids. There's two basic lumbar punctures. If you have an older child, a bigger toddler, basically you can lay them on their side, and you would have them, as the nurse, you would be the one that would be holding the infant or the toddler. You would have them on their side with the back facing where the procedure is going to be done from. You would be on the side that the toddler is facing. And you would basically have them curl up into the fetal position, in a sense, and you can lean over them and you hold them in position by putting their head underneath the one crook of your arm and the upper thighs underneath the other crook of your arm. So you're basically kind of folding them up into a little bit of a cradle position. Now, for infants, you can actually have the infant sitting facing you, and the legs would be in front of the infant, and the infant would be bending forward, so you would be cradling the head and shoulders and comforting the infant, and you'd be keeping the infant in an upright position. So that's how you would go for lumbar punctures for infants and older. Now, when we're going into I&O, it's kind of the same as, if you're doing a strict I&O for an adult wearing a brief. The way you would do this for your output is you would weigh the diaper. And the one thing that you're going to want to remember when you're weighing the diaper is you weigh the diaper before, when it's clean, so you know what the dry diaper weighs, and then you weigh the diaper afterwards. And we're going to weigh it in kilograms or grams. If you equal it all out, basically you want to remember that 1 gram is 1 ml, okay? 1 gram, 1 milliliter. 1 milliliter, 1 gram. So if you've got 37 grams of weight gain in a diaper, that's how many milliliters? 37. 1 to 1, right? Right. And 1 ounce is how many? 30. There you go. So now we're going to move into a little bit of seizure type of stuff. So we're going to start with page 544. And we're going to get into febrile seizures. Febrile seizures are a transient condition common in children between 6 months and 5 years of age. Basically, a febrile seizure occurs in response to a rapid rise in temperature. So if a kid gets a rapid onset of a fever, there's a good chance that they're going to get a febrile seizure. So, febrile seizure, raised temperature, quickly elevated temperature. Febrile, raised temperature, right? Okay. So moving on, we've got general tonic-clonic. Basically, your general tonic-clonic, this is where you have your typical seizure that everybody thinks about when they think seizure. It's falling on the ground, rigidity followed by muscle jerking. That's when you're twitching. So that's your generalized tonic-clonic. Okay? Usually you get the aura beforehand. If somebody is getting ready to have a generalized tonic-clonic seizure, they're going to say they hear drum beats, possibly, like beating drums, that sound. And it's commonly mistaken for a heart attack or a stroke. So that's your tonic-clonic seizure. Tonic-clonic, aura, drumming, falling on the ground, spazzing around. Right? Febrile, raised temperature, tonic-clonic, aura, drum beats, spazzing. Okay. Now that's on page 545. Now we get into the petit mal. Petit mal is something that is basically seen in kids. It's completely opposite as far as the appearance of a generalized tonic-clonic. You get a blank stare. It's confused for daydreaming a lot. You get a blank stare. Kids just off into space. They really don't know that they're having this seizure as it's happening. It only lasts a few seconds. It's most common in children, like we said before, and it can be accompanied by rapid blinking or chewing movements of the mouth. So lots of blinking chewing movements of the mouth. And again, they don't know that they have it. So febrile, rapid temperature raise. Tonic-clonic, aura, beating drums, twitching, right? And petit mal, daydreaming, blank stare, maybe a little bit of fast blinking, and chewing. So that's our seizures. So now we're going to go into meningitis. We're going to go to page 541 and 542. And we're going to, the first thing that you want to know is meningitis is basically an inflammation of the meninges, which is the covering of the brain and your spinal cord. So obviously we're looking at something that is brain-oriented, big problems, okay? A lot of times it is bacterial, and it's called meningococcal meningitis. It's readily transmitted to others. When it is contagious, when you have a child who is contagious, they're going to be placed in isolation until 24 hours after the IV or after the antibiotic therapy has been started. So, isolation for the first 24 hours of antibiotic therapy, meningitis. Okay, as a nurse, you want to do frequent neuro checks. You want to do frequent vital signs. Neuro checks is the big one. Obviously, again, this is the brain, so neuro. You're going to be neuro. One of the big things that you're going to want to report is the involuntary arching of the back. That's caused by muscle contractions. That condition is called opisthotonos. Hang on a second. Opisthotonos. I suck at pronouncing some of this shit. But just remember opisthotonos. And it's the arching of the back. So if you as the nurse catch that, that's a big thing that you're going to want to report. Also, a slowed pulse rate, irregular respirations, and increased blood pressure are reported immediately. So, meningitis, slow pulse, irregular respirations, and increased blood pressure. Slow pulse, irregular respirations, increased blood pressure for meningitis. You're going to report that immediately. These are all signs of increased cranial pressure, intracranial pressure. Okay, and that's on page 541 and 42. So, moving on. Conjunctivitis. Conjunctivitis is pink eye, and I don't remember where the hell that was. But basically, conjunctivitis is pink eye. And hang on, I think I almost have it. I think I'm almost there. I might not be there. Shit. Yeah, I'm not there. Conjunctivitis is pink eye, though, and it is very contagious. Hence, pink eye outbreaks in school, just about as bad as lice outbreaks. And that's also the same thing. 24 hours, I believe, is the time where it's not contagious anymore, 24 hours after treatment begins. But I'll have to get back to that. Just to double check. So, that's conjunctivitis. That's pink eye. And basically, it is inflammation of the conjunctiva in the eye. So, now we have the difference between a concussion and a contusion. So, page 553, we have concussions. And basically, a concussion, I'll give you the actual wording here. Concussion is a temporary disturbance of the brain that's usually followed by a period of unconsciousness. A concussion is basically when somebody gets whacked in the head. It's usually a result of trauma of some sort. Many of you may have already had a concussion in your life once or twice. Some of you may never have. But basically, when you have a concussion, everything just shuts down. The memory of what happens before and right after usually shuts down as well. A pretty good sign of a concussion, if you see somebody get whacked in the head, is the body will immediately go stiff. Arms will be straight out. The person will be on their back. And then usually some snoring will ensue right after that. So now, that's a concussion, 553. So now we're going to move to 563. And we're going to talk about contusions, because we need to know the difference between these. Now I got to find it. 563. A contusion is a bruise, basically. It's tearing of your subacute tissue, and it results in hemorrhage, edema, and pain. The escape of blood into the soft tissue is referred to as a hematoma, or a black and blue. So that's your difference between a concussion and a contusion. Concussions can actually create contusions in the brain, which are really no good. But contusions don't cause concussions. Now, we're going to move on to page 680. That's chapter 29. And we're going to talk about ways to prevent reoccurring UTIs, which is urinary tract infection. So basically, the nursing tips that you want to do is you want to clean the perineum after each diaper change. That's kind of a no-brainer. You want to wipe the perineum from front to back, right? Front to back. Always wipe from front to back when it comes to stuff like that. Never wipe back to front. Back to front, stinky crotch, no good. You're going to avoid bubble baths, believe it or not. Have the child urinate immediately after a bath. And you want to use white cotton underwear and loose-fitting pants. And also offer adequate fluid intake. That just kind of goes along with a lot of the adult stuff. So it's basically good hygiene to prevent recurring UTIs. Good hygiene, avoid bubble baths, cotton, loose breathing clothes. And you're good to go with that. Right? Okay, and then we have hypospadias and epispadias. So I don't have a page number on that one because I already know what this is. Hypospadias is basically the spadias part of the term is the placement of the urethra. So if you have hypospadia, it's the opening of the urinary meatus is down low. It's below the head of the penis. So you basically your pee hole's down underneath where it should be. Now, if you've got epispadias, it's the opposite. Epi means above, hypo means below. So epispadias, your urethra opening is on top of the penis. Looks really weird. I definitely recommend Googling it. It's pretty weird. And I'm glad I don't have it. Okay, prevention of Rye syndrome, no aspirin. That's a simple one. Communication in dealing with, say, a Russian family. This is something we talked about in Chapter 21. Know your cultural differences and know your cultural boundaries. When you're dealing with, say, a Russian family, again, as I said before in the Chapter 21 review, if you're dealing with a Russian family, smiling is not considered appropriate to them because in their society and their culture, this is a serious situation. Their kid is there for treatment. This is serious, it's somber, and it's all business, business, business. So no smiling when dealing with Russians. Now, we've got, let's see. Oh, I forgot one. 8-year-old skeletal traction. What kind of psychosocial developments are going to happen there? I'm not going to actually quote anything for sure, but I'm going to go out on a limb and say that an 8-year-old in skeletal traction, they're definitely going to have their psychosocial issues. They're not normal. They're not like all the other kids. They can't do everything that the other kids can do, so obviously that's going to create some psychosocial problems for them. Now, we've got adverse effect of long-term administration of fentanyl or Dilantin. And that's on page 547. And basically, your long-term adverse effect of that is going to be gingival hyperplasia. And the best way that you can fight and combat that is going to be through good oral care, making sure that the kid's keeping up on everything. Let's see. Now we're going to go to page 554 and a little bit of neuro and positioning. This is the flexion and retraction. Hang on a second. 554. Okay, so 554. We've got extensor posturing and we've got flexor posturing. And these would basically become, these would be signs of brain trauma. They can happen with baby shaking. They can happen as a result of a concussion. They're all basically a result of severe brain damage. So we've got the extensor posturing, which is called decerebrate posturing. You have rigidity in all four limbs, and they are extended, and the hands are pronated, which is basically if you curl your hands into your wrist. Like if you take your thumb and you try to touch your elbow with it, that's your hand is pronated. And then you have your flexor, which is decorticates. That's your flexor position. So in decorticate rigidity, the arms, wrists, and fingers are flexed. So basically, kind of like sitting in the hands are curled up to the chest, almost like the like a nervous person would be. The hands curl up, they go up to the throat. At this point, you have plantar inflection in the feet, so the feet they're kind of curled out. Okay, so that's it on 554. That's the difference between your two extensor and flexor posturing. So, extensor is decerebrate, and decorticate is flexor. So, I don't even know how the hell I'm going to remember which one's which. So let's see, we've got that. Now we're going to go. We've got a 2-year-old crying post-procedure. And basically the techniques to lower the stress for that would basically be to hug the kid. If the kid is still breastfeeding, you can go right to breastfeeding with the kid. That's going to help him soothe. Transitional objects. This is something that we talked about also in chapter 21, and it's on page 481. Transitional objects are basically familiar objects, like a favorite stuffed animal, a favorite blanket, something like that. Remember Buzz Lightyear? We talked about Buzz Lightyear. Okay, so now we're going to move on to page 531. I keep saying we're moving on, and we move backwards. I hate it when that happens. So we're going to move to 531, and we're going to talk about osteitis media, which is basically inflammation. It's an ear infection. So, the people that would be most prone to ear infections commonly is what we talked about earlier, young kids, toddlers, infants. Again, the eustachian tubes are shorter, they're wider, and they're straighter, so they're very prone to infection and things just kind of getting hung up in there. So that was page 531. Now, 532. We're going to move on. When you have patients that get common ear infections, what can happen is the eardrum can actually rupture. And sometimes in order to prevent the eardrum from rupturing, you have what's called a laryngotomy. And it's also called a tympanostomy. And ostomy is what? A surgical incision, right? So sometimes we actually have that surgical incision created into the eardrum to prevent it from rupturing. And sometimes they can put in a button or a ventilating tube. So, and a lot of these are, some strange reason over the past 15 years, been seeing a whole lot more of the ear tubes going on in kids. I don't know if it's that it's something that the medical world is becoming more aware of, and that's why that treatment is more common, or if something's going on with kids just growing and developing differently. Who the hell knows? So, anyway, so that's what that is. And sometimes they can just come out. So you want to let the parents know there is a possibility that the kid could wake up and all of a sudden that tube is on the pillow. And it's not really anything to worry about. They just want to go back in and check with the doctor on things. Okay, 537, hyphema. Flipping pages, flipping pages, flipping pages. Okay. Hyphema is, I found the pink eye stuff. Here we go. We're going to go back to pink eye. Pink eye is no longer considered contagious after 24 hours, like I said before, of appropriate antimicrobial therapy. When parents or older children are wiping secretions from the eye, basically going to start with the inner canthus, and you're going to move downward and away from the opposite eye. So if you have pink eye in your left eye, you're going to wipe from the inner canthus, and you're going to wipe to the left side of your face, because you don't want to reach across, and you don't want to wipe the stuff from your bad eye into your good eye. Now you end up with double pink eye. Okay, so now moving on to hyphema. Hyphema is the presence of blood in the anterior chamber of the eye, and this is basically a result of trauma. And most times they do go away. Actually, anybody who knows me knows that I have one right there in my left eye. It's been there since I was 14. I never got it treated. But basically it just appears as a bright red or a dark spot in front of the lower portion of the iris. Treatment includes bed rest, topical medication. The head of the bed should be elevated, high Fowlers. And that decreases your intraocular pressure. So, that's hyphema, page 537. Now, we're going to move on to page 683, chapter 29. And I got to flip a little bit more. Kicking along to ICP while I'm doing it. Okay, 683. you want to know the differences between nephrosis and acute glomerular nephritis. Okay, now, nephrosis has an unknown cause. It could be a thymus T-cell dysfunction. Acute, let's see, we'll just go down with nephrosis first. Nephrosis has unknown, it may be a thymus T-cell dysfunction. You can get massive edema, whole body edema, and fluids in the body cavity. Okay, your blood pressure is usually normal with nephrosis. Your urine tests are going to show proteinuria and trace of blood. And your pallor is going to be greater than expected in relation to your degree of anemia and your appearance resulting from edematous tissue. So, unknown cause for nephrosis, possibly thalamus. Massive edema. Nephrosis, massive edema. Normal blood pressure. Nephrosis, massive edema, normal blood pressure. Trace of blood. Now, we go to acute glomerular nephritis. It's usually a response to an infection with group A beta hemolytic streptococci. So we are looking at infection, right? Okay. Now, you get periorbital edema. So basically your edema is not going to be a whole body like it is in nephrosis. In acute glomerular nephritis, you're looking at periorbital, puffiness of the eyes. So it's going to be right around the eyes. Your blood pressure is usually going to be a little bit moderately elevated, and you're going to get a trace of protein in the urine. It usually resolves within 1 month, but urinary symptoms can persist for up to a year. And your pallor is going to be more related to anemia, so you're going to be white, ashy a little bit. So, nephrosis, T-cell dysfunction, massive edema, blood pressure normal. Acute glomerular nephritis, response to infection with A beta hemolytic strep, eye edema, only the eyes. Okay, so acute glomerular eyes, and your blood pressure is going to be a little bit moderately elevated. So that's 683. Okay, 686. We're going to move on a little bit. And there's a condition called cryptorchidism, and that's basically when the testes do not drop down into the scrotum. So, crypt obviously means hidden, and orchi is the testes. So, you've got hidden testes. That's cryptorchidism, and the way that is treated in some situations is called an orchiopexy, and that is basically surgical fixation. It's how they get the balls to drop. And that is on page 686. Now, hopping around again, like a one-legged man in an ass-kicking contest, we're going to go back to page 533. And we've got the nursing tip box. And this is basically about communication with a hearing-impaired kid. When you are addressing a hearing-impaired kid, you want to be at eye level with the kid. So we're not talking about deaf, we're just talking about hearing impaired. They can still kind of hear. It's a lot of the same stuff if you were dealing with an elderly patient who's hard of hearing. You want to be at eye level. You want to be face to face, because even kids read lips. So eye level, face to face, establish eye contact, because if you're looking at somebody in the eye, you're paying attention. And you're going to talk in short sentences, just like you would if it was an elderly patient. And you're going to avoid using exaggerated lip or face movement, again, because kids do read lips. So, if you have a lot of facial hair, like a goatee, and if it's real bushy, you're also going to want to speak a little bit clearer, because that actually does affect how they can read lips. That gives them problems. So that's 533, communication with hearing impaired kids. Okay, so we're going to go to 542. And on 542, we have nursing intervention for a kid with infectious meningitis. And a child diagnosed with infectious meningitis remains on transmission-based droplet precautions until 24 hours after appropriate antimicrobial therapy is started. So again, it's 24 hours. 24 hours, 24 hours of medications. That's for meningitis, and that's for the pink eye, for conjunctivitis. Okay? And again, that's like we were saying before, you're going to want to make sure you do frequent neuro checks on a kid with meningitis. And we've got page 534, preventing barotrauma. Baro means what? Baro means pressure, right? The weather guys are always talking about barometric readings before a storm because the atmospheric pressure changes. So baro is pressure. Okay, so 534. Barotrauma occurs when there's a change in atmospheric pressure. Look at that. Between the internal body systems and the surrounding environment. A big example of that would be a pressurized cabin of an airplane. So if you've got a kid who is traveling with you on an airplane, again, their eustachian tubes are a little bit different than ours. Their system's not quite as matured. It's not as, it can't fight things just as easily as ours can. So, to prevent that barotrauma, especially if you're in an airplane, or even, believe it or not, where I live, where I used to live, there's this one mountain that you go up, one hill you go up, and your ears pop going up this hill, and it's just such a rapid climb, and it's a change in pressure. So basically you want to encourage them to constantly yawn or chew on gum to promote swallowing, because that actually flexes the muscles up by the eustachian tube and allows the pressure to equalize itself. So that's basically it for our review, and I'll see you next time. Have a good night and good luck.